call this meeting to order. Welcome to meeting number 85 of the House of Commons Standing Committee on Health. Today's meeting is taking place in a hybrid format pursuant to the standing orders. For those participating via Zoom, you just click on the microphone icon to activate your mic, and please mute yourself when you're not speaking. Interpretation is also available to you. You have the choice at the bottom of your screen of either Floor, English, or French. Screenshots or taking photos of your screen is not permitted. In accordance with our routine motion, I'm informing the committee that all remote participants have completed the required connection tests in advance of the meeting. Pursuant to Standing Order 108 Sub 2 and the motion adopted on October 4th, 2023, the committee is beginning its study of the Department of Health's regulatory changes for natural health products. We have two panels of witnesses. I'd like to welcome our first panel, à titre personnel, Mackie Vadicino.
As an individual, Mackie Vadicino.
Institute for Safe Medication Practices Canada, Sylvia Hyland, Vice President Operations and Privacy Officer, and Dr. Melissa Sheldrick, a Patient and Family Advisor. Thank you all for taking the time to appear today. You have up to 5 minutes for an opening statement, et on va commencer avec vous, Madame Vadicino.
And we will start with you with Ms. Vadicino. Welcome to the committee. You have the floor.
Merci. J'aimerais commencer.
Thank you. I would like to start by thanking the committee for this opportunity. Industry representation is needed, not only so that we can tell our side of the story, but also so that we can properly correct the mistruths and damaging statements made by Health Canada. My name is Mackie Vadicino. I'm a proud Quebecer and an active member of the Montreal Italian community. I've been involved in the natural health products industry since 2004 and currently sit on the board of several companies in our industry, which comes after 15 years of CEO of Bioforce Canada. Over these years, I've been involved with many changes from Health Canada, on which we work together to find mutually beneficial outcomes. This time around, though, in addition to the financial and environmental negative impact, what we found most difficult to accept was the total disrespect for our industry, for our businesses, and for us as Canadian citizens. The impact of the new regulations brought forward by Health Canada are comprehensive and very costly and will have an impact on the supply chain in this industry. And in this industry, you have, for the most part, smaller companies and suppliers. We cannot forget the small local operators. In Quebec, supporting local is a source of pride, and unfortunately, the implications of these changing regulations will be felt at the community level, local health food stores, and they will lose a significant number of their products from their shelves. So when it comes to the financial stability of smaller businesses, people's mental health under this stress, and the increase in prices projected to be 30 to 35% for the consumer, as well as the environment, of course, which is a real concern for all of us in this industry. The new label laws that go into effect in 2025, just 2 months after the proposed cost recovery fees, will require the use of a peel-back solution for most products, which makes the entire container non-recyclable, or an increase in packaging size to accommodate the new compulsory format. Like every other NHP, natural health product company in Canada, many brands will be forced to dramatically increase their environmental footprint. The guidance for the new labels is inflexible, outdated, and out of touch. This industry is built around natural. Our ingredients come from the earth, and we cannot disregard the environmental impacts the new labeling laws will have. The new requirements will also make reading English or French much harder, because, of course, hosting two languages on the same size packaging will be extremely challenging. for many NHP products due to their multi-ingredient nature. A QR code or a smart label could be potential solutions. Now, when it comes to the proposed cost recovery fees, these are so costly that even with the proposed small business mitigation, many small businesses will simply not be able to afford to bring any new products to the market. So Canadian innovation in the industry will be stifled. So we ask Health Canada to reassess the application fees to encourage the industry to be compliant in obtaining pre-market approval and also allow Canada's natural health product system to remain the most respected in the world. The Canadian NHP industry also faces fierce competition from our U.S. neighbors and other countries as well, who market and promote dietary supplements to Canadians online. These U.S. supplements are not regulated, and their laws regarding claims, health claims or other, differ greatly from Canada's. The majority of Canadian NHP companies are not against regulations, but if these regulatory changes are truly about the health and safety of Canadians, then we really need regulations that take into account the many challenges and realities the sector faces in today's day and age, and the size of the businesses that make up the majority of the industry, and the need for innovation that will continue to allow Canadian industry to offer natural, low-risk products to all Canadians.
Thrive under self-care framework, and I'm honored to be here today to offer insights that can be useful and productive. Je vous remercie de m'avoir accueilli.
Thank you for having me. Thank you, Ms. Vadakino.
From the Safe Medication Practices of Canada, Sylvia Hyland or Dr. Sheldrick, or maybe you're going to share it, but you have 5 minutes and you have the floor. Welcome.
Thank you, Mr. Chair. On behalf of the Institute for Safe Medication Practices Canada, ISMP Canada, we are pleased to be here today to speak to this important topic. I'm Sylvia Hyland, VP Operations and Privacy Officer, and joining me is Melissa Sheldrick, Patient and Family Advisor. ISMP Canada is a pan-Canadian, not-for-profit and independent organization established in 2000 to improve the safety of drugs and health products. Our key activities are analysis of errors, making recommendations for improved safety, including labeling and packaging, and supporting consumers, care providers, and other health system partners to implement these recommendations. Through our reporting and learning programs, we have received reports of preventable harmful errors involving natural health products. We have shared information through the numerous Health Canada consultation processes and stakeholder engagements. In our analyses, we identified 3 main areas of concern related to natural health product labels. The first concern is the inability to easily and consistently identify ingredients on the label. We recently received a report about a selection error involving an umbrella brand name. This means the same brand name is used for products that have different key ingredients. The report describes purchasing a product for a baby, believing that the product had vitamin D in it. The reporter was upset to find that unlike another product with the same brand name and typically associated with vitamin D, the product purchased had no vitamin D. We have also received reports of selection errors for products using the same brand name for both a non-prescription drug that has a drug identification number, or DIN, and a natural health product that has a natural product number, or NPN. An example is a consumer reporting harm from taking a ginger and willow bark product when she had intended to take the diamond hydronate product with the same brand name. Consistent use of a product facts table will identify key information for the consumer and also the healthcare provider. It is essential for both to easily and consistently find the ingredients when selecting and comparing products. The second concern is unclear information about the dose on the label. Consumers and healthcare providers need to easily locate and understand the recommended dose for the product on the label. We have had reports of harm due to misunderstanding the dose information for a natural health product. Thirdly, lack of an important warning or inability to easily read warnings when selecting a product from the shelf. The list of NHP medicinal ingredients is broad, and includes ingredients known to have possible adverse reactions. Examples include scopolamine, pseudoephedrine, and salicylates. We fully support the improved NHP labeling requirements. We also fully support the inclusion of natural health products under Vanessa's law. Consumers trust that there are requirements being followed for the products they buy. It is important that Health Canada has the authorities and resources to conduct regulatory activities, provide enhanced oversight for compliance and monitoring, and also to sustain the improvements being made.
Health Canada estimates there are over 200,000 natural health products available to Canadians on the market, and consumers expect them to deliver and monitor safe products. Consumers have many choices when they're trying to self-select products off the shelf, and while this choice may be welcome, it can be overwhelming. Consumers have to do their own research about the products they buy, which can be difficult for many Canadians, and it can also be challenging to do this research at the point of selection. I would like to draw your attention to the image that we sent to you of the label of container of protein powder. This label has elements of safe label design, and we have a green arrow on the image pointing to the facts table, which is clear and easy to read. The red arrow is pointing to the section of the label that describes the cautions. This is where there's important information regarding the use of the product, such as the conditions under which people should not use the product. This warning section must be made more prominent. In 2016, I lost my 8-year-old son, Andrew, to a medication error made during the preparation of his liquid medication from a prescribed pharmaceutical powder, and one of the contributing factors was the design of the label, which was improved by the manufacturer soon after. ISMP Canada has made recommendations for labeling of pharmaceutical powders, and we have created guidelines for labeling and packaging of prescription drugs, non-prescription drugs, and natural health products. All labels are important, and there are principles for safe label design, for example, the prominence of critical information and legibility of key information that can and should apply to all of these labels. The changes recommended by Health Canada will result in key steps to address the concern reported by consumers and healthcare providers. In addition, consumers think that this is already happening. Thank you, Mr. Chair.
Thank you both. We're now going to move on to rounds of questions, beginning with the Conservatives. Dr. Ellis, please, for 6 minutes.
Well, thank you very much, Chair, and thank you to the witnesses for being here today. I think that one of the things that we've noted here is that we have probably had more concerns from Canadians with respect to natural health products than anything else. And this is a sampling of those. You know, when you begin to receive these stacks, this is kind of like that miracle on 34th Street. You know, when you see stacks and stacks of mail to prove who was Santa Claus. You know, and that's a small smattering thereof. And I do have a motion that I'm going to move, Chair. And I think that Canadians need to know that we have heard them loud and clear as to the importance of this topic. And that is by virtue of the vast amount of complaints that we've received from consumers, and that they want someone to stand up for them, and that we want them to know that's going to be the Conservative Party for their freedom of choice and the opportunity not to decimate an industry. Very clearly that we know that the cost is going up. There's another analogy, Chair, that has been given multiple times in the House of Commons that talks about when you tax the farmer that grows the food, you tax the trucker that ships the food, the person, of course, who buys the food is going to have to pay more for that. And we know very clearly in this particular case that this is the exact same situation. What we're asking here is that for producers, manufacturers, and distributors are going to have to pay more in the natural health product sector. And obviously, when that happens, there's a trickle-down effect, and consumers will end up paying more. And we also know very clearly, Chair, that when consumers have to pay more, then there's going to be less choice in the market, because there are going to be those particular manufacturers and distributors who are not able to sustain their presence in the market. We also know very clearly that in this particular sector, that Canada is the envy of the world when we look at the regulations around natural health products. And when we see those things, that doesn't mean that Canada doesn't need to continue to improve. Even if you're a world leader, you obviously should continue to try to be better. But that being said, should you do that at the expense of an entire industry, and also when clearly Canadians want to have their choice? You know, I was speaking to one of my learned colleagues today, and when we talk about choice and we talk about Canadians having to do their research, guess what? It snowed today. Winter is coming. We all need to put winter tires on our cars. Well, we have to do research there. That's an incredibly important part of being a Canadian and being a good consumer. It's about safety. It's about choice. It's about cost. And we all have to do our own research there. We don't have government reaching into our lives and suggesting that that they need to be the final arbiter of what is right and what is wrong in everyone's life. And I would suggest that that this particular industry is somewhat akin to that. Yes, it is. It's about personal choice, and it's about having information available to you. But it's also about the fact that that people need to have the ability to make those choices themselves. And when that happens, that's very, very important. It is about safety, but it is also about freedom. And again, this is also tied to a significant industry here in Canada. And given that, the motion then that given the proposed cost recovery and labeling regulations on natural health products are expected to have negative impacts on both Canadian businesses and consumer choice, the committee calls upon the Minister of Health to immediately revoke these changes, and the committee report this motion to the House. So why is this important? Again, it's about consumer freedom of choice. It's about Canadian businesses being affected, and it's also about perhaps the unfair application of these rules to international companies. Very clearly, we know that that there's an international economy around natural health products, and we also know very clearly that because Canadians want to continue to have choice, that if they are not able to have that in the Canadian market, that it's very easy to purchase these products online and have them shipped to your home in quantities for personal use. And they will not have the appropriate labels, and they will not have the safeguards in place that the Canadian system does. So instead of tearing down a Canadian system, I would suggest that it would be exceedingly important that we work with industry to continue to build up this incredible industry which has flourished in Canada. And by evidence of this gigantic stack of mailers that has been sent to every one of the offices, including, I know, my colleague across the way specifically mentioned to me that this is probably the issue that that individual over there has seen the biggest amount of correspondence in the entire 2 years that this Parliament has been in session, and he or she shall remain nameless, just to be kind to them. So when we look at that and understand that Canadians are considerably concerned about their access to natural health products, and that Canadians believe that the regulatory framework that we have at the current time allows them to access products which are safe and which they have the opportunity to look at themselves, it is important. Now, we do know very clearly that the Liberal government wants to regulate everything in our lives. They want to regulate the internet and what we can see and what we can hear and what can be posted. We know very clearly, yes, the internet has ostentatious claims of this and that or the other thing. I was watching something this morning that said you shouldn't drink cold water before you eat, because there's some negative effect. Now, when we look at these things, people also have incredible access through the internet, which is now being censored here in Canada. People have incredible access to good information as well. You know, I was thinking this morning that I had heard a reference before about how much protein you could possibly eat in one sitting, and how that may or may not be absorbed, and how much you could have. And very quickly you come upon a trusted source, the Mayo Clinic. Chair, I'm not sure what our colleague is doing in the video feed, but maybe he was taking a picture, but I'm not sure, Chair. Maybe someone could communicate with Dr. Hanley and clarify that. It was very distracting nonetheless. But you know what? There is great information that's available out there. When people specifically want to attempt to find the information and know sources that can be incredibly useful in our ability to do our own research. You know, the sad part, of course, is in Canada over the last several years, everybody has become their own expert. You know, people don't want to believe doctors and scientists and folks like that anymore, that they believe that they read something on the internet and then suddenly it has become true. And I do believe that a lack of belief in science and scientific analysis, that needs to be corrected. I don't believe that regulating natural health products further and making them less available is the way to do that. I don't believe that in any way, shape, or form. Understanding very clearly that the stakeholders that we've discussed these changes with,
Mr. Chair, I have a point of order.
Especially the cost recovery changes.
Excuse me, Dr. Ellis, a point of order for Mr. Davies, please.
We've been through two meetings previous to this where the Conservatives have filibustered the meeting and not really let anybody else speak. I'm just wondering if my honourable colleague intends on filibustering this meeting, because I would rather hear from the witnesses who have been called here from the natural health products industry and have the benefit of their testimony and experience before we even vote on a motion of Dr. Ellis. I wonder if he's intending on filibustering the meeting, then maybe we can let the witnesses go if he doesn't want to hear from them. But I think it's rude and to let the witnesses have to sit here. They've come here to testify. If Dr. Ellis has no intention of letting the committee hear from them or having these witnesses lend us their expertise and experience, which I would like to have before this committee.
Not sure it's a point of order, but Dr. Ellis, if you want to address it, feel free, and if you don't, you have the floor again.
Thank you very much, Chair. You know, again, the arbiter of this committee has intervened, sadly, to want to give his opinion on how committees should run. This motion has been duly tabled before this committee. It was available for everyone to be able to see. And you know what? It's an important motion, and I would hope that my honourable NDP colleague would support the motion to defeat the Liberal government, sponsored by his NDP colleagues, attempt to make changes to decimate an industry and remove freedom of choice from Canadians. So that would be important. That being said, Chair, returning to the matter at hand, you know, we have spoken to many stakeholders, as I appreciate and hope that many of my colleagues have as well across the floor, to understand that the almost incalculable regulations that have been put forward by Health Canada really makes it difficult to understand exactly how much these regulations are going to mean to Canadian manufacturers and distributors of natural health products. However, we do know very clearly that when attempting to give these estimates, that many businesses could see losses in revenue of the hundreds of thousands of dollars. And this is what leads very clearly to the significant belief that many Canadian businesses would actually go out of business, and the industry would estimate that 1 in 5 businesses in Canada would go out of business related to these unfair and overburdensome and regulatory changes. So when we begin to look at that and we begin to understand that there is good information available out there, couple that with the need for Canadians to have a freedom of choice. And Canadians have to have that ability to say, this is how I wish to manage my own health. And are Canadians going to make mistakes with respect to that? That is absolutely possible. But we cannot protect every citizen from every eventuality. That is not a style of government that any of us wishes to participate in, that we have governments that absolutely control every movement and every thought that you have. Now, that is not a country that I would like to live in, or that we have a government that attempts to meet every need every anticipated need that I could have in my life. And therefore, in an industry such as the natural health products industry, which is underscored by the fact that people want to manage their own health and have the ability to do so, I would suggest that the regulatory changes that we see coming forward would be untenable, not just from a fiscal perspective, but from a freedom perspective. The other thing I would like to bring forward very clearly is that when we had the panel from Health Canada here, and even in their follow-up information provided to us in written format, they continue to talk about some 700 people who may have been harmed in some way by natural health products. Chair, I would suggest that at some point it would be quite fascinating if this committee sat together to attempt to access this database, which is really, there's no other word for it, but it's inaccessible and quite ridiculous in how it is framed, which then allows this government, this Liberal government and Health Canada bureaucrats to be able to sit behind their numbers and say, oh, well, this actually does exist. There are 700 people, some of whom may have been harmed and may have been hospitalized. And you know, when you don't have a database that is clear and searchable and would stand as a reference to say this is exactly where these numbers came from, well, that is not a helpful reference. And indeed, I would say that it is a useless reference. Certainly, when you look at the experience that we have on our team, not just with our members of parliament, but with our staff, and still come up with an inability to make any sense out of a reference used to support, the main reference used to support these regulatory changes, I would say that that is nothing but a sham and a sleight of hand. When we know very clearly, and to underscore this, Chair, and I know that committee members know this, but I was a family doctor for 26 years. I wrote a lot of prescriptions, and I believe in that science that exists, and it's helped people live longer and suffer less. But when we know very clearly from a good reference that every year in this country, 50,000 seniors are hospitalized, not just harmed, but hospitalized by the use of prescription medications. Now, does that mean that we should decimate that industry, that we should make it almost impossible, that we should add useless labels to people's pill bottles, that we should say people don't have the freedom to make their own choices, all of the same regulations and adding to them, which even though they have perhaps stricter regulations than those on natural health products at the current time, because that many more people just in the seniors group are hospitalized by prescription drugs, does that mean that we can expect an assault on prescription drugs as well? We know very clearly that prescription medications and over-the-counter medications have potential and serious side effects, but we also know their benefit. Therefore, when we allow Canadians to have this freedom of choice in a sector, as I said previously, which would be the envy of the rest of the world, and we know clearly that that is a desire that Canadians have, and we have a shady database on which the decision-making was based, and we know that this certainly is something that will decimate an industry, and we know very clearly that the industry is not in favor of said changes, then, Mr. Chair, I do believe that we need to speak up loudly and vociferously on behalf of Canadians and let them know clearly that Conservatives wish them to continue to have their freedom of choice and that we wish to fight the regulations proposed on their behalf. We wish to fight those regulations proposed by the Ministry of Health and Health Canada. So that is the reason why, Chair, that we have moved this motion. I realize that there are folks here to testify on this behalf, and I want to be respectful of that. The other part of it, though, of course, is, as my colleague has been want to bring forward many times, that this committee is the master of its own destiny. And therefore, if we wish to have further meetings on this topic and have more stakeholders present and more witnesses present, including members of the public, then we are certainly able to do this. And I guess I would suggest, Chair, that given this incredible stack of papers that everyone in this committee has received, that adding more meetings to the natural health products sector and the proposed draconian regulatory changes by Health Canada and by this Liberal government supported by the NDPs would not be such a bad idea. So, Chair, I shall leave it at that. Thank you.
Thank you, Dr. Ellis. The motion is in order. The debate is on the motion. And next up is Mr. Doherty, please.
Thank you. Thank you, Mr. Chair, and thank you to our colleague. Just for the purpose of this conversation, I will read again what the motion is, that given that the proposed cost recovery and labeling regulation on natural health products are expected to have negative impacts on both Canadian businesses and consumer choice, the committee call upon the Minister of Health to immediately revoke these changes, and that the committee report this motion to the House. And Mr. Chair, I bring this up again because, as it has been mentioned, I'm not quite sure the exact amount of correspondence that we have received, but I'm on record as saying this is by far the topic that has garnered the most correspondence and messages and emails, calls to my office in my 8 years of being a parliamentarian. Unbelievable. The amount that we've got. I think we have bankers boxes, a number of bankers boxes, both in my riding office and here in Ottawa, and my Hill office, just filled with flyers as such. Really, Canadians' feedback, and that's, as I've said before, why we're here, is to listen to all Canadians, regardless of political stripe and their political leaning, as we are here to listen to them. I do want to bring us back to the first meeting that we had on this, where I had my intervention with Dr. Sharma, and I think, Mr. Chair, if I might, part of the reason why we have concern over this is testimony from and Dr. Sharma's comments. If you will remember, it was Miss Sharma's or Dr. Sharma's testimony that over 700 Canadians have lost their life due to mislabeling. Again, as I've said before, I don't want to see anybody lose their life due to this. Deeply concerning, but some of her comments were suspect. And if you'll remember, I raised those points with her. She used a case specifically, one that I was familiar with. That was the death of 18-month-old Ezekiel Stefan, and she attributed the mislabeling of healthcare products in her testimony to one of the important reasons as to why these regulations need to take place. I believe her exact testimony was, we've already seen the death of an 18-month-old child. When I questioned her on this, saying that, in fact, her testimony was misleading, she gave me kind of a verbal gymnastics explanation as to why she used that. And when I pressed her on it, she refused to kind of back down from that. The reality of that case in itself is that Ezekiel had was struggling with, was fighting meningitis. You had a young parents that mistakenly thought that their baby, which I believe was their first, was struggling with strep or croup. I couldn't imagine what they were going through. I've got 4 children, all adults now, young adults. I've got a young granddaughter, and especially during those, if it's your first child, every time that baby cries, you're wondering what's the problem, what's going on, how do I help? They were grasping, and so they thought they were doing the right thing, and they presented not necessarily health care products or natural health food products, but home care remedies. I believe one was like a garlic and apple vinegar tonic, I think, is one of the things that they did. And when the baby actually, when it got to the point where the baby was really struggling and they called for an ambulance, that ambulance was not equipped with actual breathing devices that could fit an infant, which ultimately led to that baby's passing. Not natural health food products. It was a combination of terrible events. I read that back into her. I bring that back up because I believe we're rushing here. Our health care or our natural health food industry is regulated. We definitely had testimony from the Health Canada officials that were here, who said that they did their due diligence, that they conducted surveys. I believe that was what Dr. Supriya Sharma said. And again, going back to Dr. Supriya Sharma's comments, Mr. Davies, again, I'm calling him a doctor. Mr. Davies' last question to Dr. Sharma was, I think it would help Dr. Sharma and all of us with this. In that case, did the product that was given make a claim that it would treat the particular ailment that
Point
child
of order
had?
from Ms. Sidhu.
Mr. Chair, I know everything is important here, but we heard important testimony from Ms. Sheldrick, and we want to know more. We want to ask the questions. So she lost her son, and I think many members of the committee, we want to ask the question to the witnesses where we can work together. I urge my colleagues from the other oil so we can listen to those, we can listen the testimony, and then we can work together. And if the other question I want to ask, if they can stay till the next panel, because it's very, very important to ask the questions. That's all, Mr. Chair.
Thank you, Ms. Sidhu. Although all valid points, not points of order, the motion is in order. They're allowed to bring the motion, and it may not be something that everyone likes, but they are entirely acting within their rights. So go ahead,
Thank you, Mr. Chair.
Mr. Doherty.
I'll go back to the last question that Mr. Davies, and again, I think it frames what we're talking about here with this motion and the reasons why we have concerns with it. Mr. Davies, I think it would help Dr. Sharma and all of us with this. In that case, did the product that was given make a claim that it would treat that particular ailment that the child had? Dr. Supriya Sharma, we don't have the details. We don't have the details. Yet that's one of the cases that she cited as to why it is so important that this industry face costly regulations that will see, that could potentially see the demise of 60 to 70% of these small businesses. If what we're also hearing from those officials is that a majority of the businesses in this industry are small to medium-sized businesses. You know, Mr. Speaker, or Mr. Chair, the Canadian Health Food Association is the largest Canadian organization dedicated to natural health and organic products. Their members consist of over 1,000 businesses across Canada, including manufacturers, retailers, wholesalers, distributors, and importers of natural health products. And indeed, natural health products are an important source of organic and wellness products used by over 71% of Canadians. Mr. Chair, the industry is a $5.5 billion industry. It generates $2.8 billion in taxable revenue and supports over 54,000 Canadian jobs. As I said, many of them are small to medium. After accounting for the full supply chain and increased economic spending, its total footprint is estimated to be $11 billion of the GDP. 86% of the businesses have within the sector have 50 employees or less. The reason why I say that, these are the backbone. These small businesses are the backbone of this industry. And these regulations are at risk of closing the doors of these small businesses. 94% of those businesses within the sector have 200 employees or less. 97% of the businesses within the sector have 500 employees or less. But these discriminatory regulatory changes under the outdated and broken self-care framework will crush the small and medium-sized businesses. They'll have a profound impact. 83% of these businesses say that they will struggle to absorb the costs that these regulations will bring in. 76% of the industry respondents indicate high likelihood of product removal from Canada, meaning Canadians won't have access to these products. 66% say employment will suffer, resulting in devastating job losses. 1 in 5 businesses are at risk of closing. Now, our colleague in his intervention mentioned, his concerns. My primary concern to this is not just the testimony of Dr. Sharma, which I find suspect. I'm sorry. I gave her multiple times or opportunities to withdraw those comments. As I said in my testimony, I believe her to be a good person, but it is misleading when you stand here before a parliamentary committee and you provide testimony as such, and you don't have all the facts. And because she is a doctor, and we just take that testimony at face level, and I think that, Mr. Speaker, it behooves all of us to do the research on that, which is why I questioned her that day. But overwhelmingly, it is this Canadian industry that we are at risk of decimating due to these unnecessary regulatory changes, and I'm not discounting the testimony that we heard today. And the testimony that we heard, the written submissions as well. And I think, again, as Dr. Ellis had mentioned, the 700 deaths that are being attributed to mislabeling, when you asked for data on that, we're not able to access that. At least I haven't seen the data on that. 700, sorry, it's not deaths, 700 adverse effects. My mistake. Those are events and cases that, again, that's why I got that I made that mistake, because my understanding it was deaths. And if we had the data, perhaps then we could accurately state our facts. Again, what we need. But again, going back to Dr. Sharma's testimony, I take no joy in doing this, but Canadians deserve us to do our job when we come here. I've said it before. I'll say it probably multiple more times. during the course of our committee work. Committees are supposed to be the masters of their own destination, and we're here to do the job. We've got medical experts on this committee, and sadly, we are relegated to not talking out the clock, but having to take control, because what we've seen in the past when we ask questions or we push for discussion outside of what is the government agenda, debate gets adjourned, or we get railroaded, and that's sad. So with that, Mr. Chair, I will cede the floor to the next speaker, and I support my colleague's motion. Thanks.
Dr. Kitchen, please.
Thank you, Mr. Chair, and I thank my colleague for educating a lot of us on some of the inconsistencies and possibly misinformation that was provided by Dr. Sharma at the last on this very issue of this unfortunate demise of this young child. You know, it's interesting as my colleague presented to us today, and the stacks of information that we've received from all across this country. And he's on the East Coast, I'm in the prairies, my colleagues on the West Coast. It's going all across, and we've all received this. And as he's indicated, our colleagues across the way, I know, have received it as well. And pointing out so many issues here. Now, when we look at this motion that's being put forward to us, it's being very clear and very straightforward. Because the reality is what we're seeing here is a discussion that we're having on regulatory changes that were presented in C-47, in particular dealing with sections, I believe, 500 to 504. And the changes that are being imposed upon small businesses in Canada that provide, as my colleague has pointed out, tremendous economic benefit to this country. And the huge impact that that's going to have on those consumers and the right for those consumers to choose what they would like to use. Whether it's vitamins, you know, I take vitamin D and I take vitamin C and I use Jameson brand, that's what I use. It's a product that I've used for many, many years. But there are so many other ones out there. And it's very clear on that exactly what I'm taking. Ultimately, the process is there's a regulatory step that's in place. Could it be improved? Yes, it could be. And maybe the industry, and in my conversations with people on it, they've indicated that they are prepared to make those changes, to adjust that, so that we can have that avenue. On the issue of dealing such that people can actually read what's put out there, they've also indicated the great value of maybe adding more into it. However, with that said, the packaging part now becomes a huge aspect, because if we're dealing with 100 tablets of vitamin C in a small tube, the amount of paper that has to be produced to put on there in print that people can read, and I have to put my glasses on, and I don't have them with me when I do it, that's on me to know what I'm reading and what I'm not. But ultimately, that cost is going to be in the millions and hundreds of millions of dollars to the industry, which in turn is going to have a huge impact and resulting on Canadians in all across this country. And I like to use the word trickle-down effect, but it is a huge trickle-down effect. I talk about it from the petroleum industry point of view, and how shutting down the petroleum industry and the coal industry and the energy industry trickles down to those small communities. The same thing happens here with natural products. You start impacting upon that, and that trickle-down effect is going to affect small businesses. And now a small community that has a small business person in there that maybe employs 1 or 2 people now lays off 1 person. So that person now has a family of 5. Where do they go? They move somewhere else. That community is impacted. And so on and forth. It trickles down. The schools get impacted because they don't have the kids that are in the schools. These are huge impacts that are there. And we need to be aware of that. And this motion is basically saying enough of all of this. Let's support this and go back to the government to say, hey, enough We don't see this as acceptable. These changes are a huge impact on the economy and on the industry. You know, our witnesses today talked a little bit about, talked about adverse effects. And you know, one of the things I wrote down when she made the comment about it was, how many adverse effects do you, because Dr. Sharma has said 700. Now that's 700 of a population of, what's the population of Canada? You know, 30 plus million people.
Point of order, Mr. Chair.
You do. Point of order.
Calling the testimony of Canada's Chief Medical Officer is misinformation and it is dangerous. Thank you. Thank you, Mr. Chair.
Yeah, thank you. That's debate and not a point of order. Dr. Kitchen, go ahead.
Thank you, Mr. Chair. Ultimately, when we look at these, and you know, the research out there says that in hospital situations, 7.5% of the patient population that gets admitted into the hospitals is due to adverse events to regulated prescription medications. 7.5%, that's huge when you compare that to 700 to natural health products. Ultimately, you know, a study by the Canadian Adverse Events Study, when this one is back in 2004, showed that there were 185,000 of 2.5 million patients of hospital admissions, of which 70,000 of those could potentially have been preventable of prescription medications. So to turn around and say 700 from natural health food products, look at the difference. It's a huge difference in those numbers. And this, I think, is a very educational part where we need to be very aware of these facts and turn around and say, yes, there are adverse facts. Yes, the industry needs to make certain that they're doing what they're doing, and they need to be stepping up to make certain that's done. And I believe the industry is doing that and making the steps, and they're prepared to make changes. But when all of a sudden this government turns around and starts putting in, you know, right to sell per item costs to that industry, it's a huge cost. And that's an annual cost for every product that they have. Then you turn around and you take a look at the class of level of the product that they're trying to sell. I remember when I was a regulator and dealing with in the industry and in my profession, and where people brought across the table a new ultrasound machine, which had to go through front of Health Canada, and in front of Health Canada, it had to go through, you know, the process of making sure that it's appropriate. But that cost was huge. Now, granted, we're talking about a product that's providing an ultrasound treatment to somebody, and yes, there's a lot of issues that can result in various side effects there, so that product need to be regulated appropriately. But the costs were huge. But when we're talking about a health food product like a vitamin, and we classify that and we have these huge thousands of dollars of costs, and then on top of that you have the site licensing fees, which are supposed to be based on a cost recovery, yet no one's done an assessment on exactly what that cost is. These are huge amounts. And I think these steps are not in place and the processes are not in place to follow those aspects and to make certain that we're doing what we should be doing. So, yes, I think with my colleague's motion here, he's put forward a motion that we're dealing with that I think we need to look at immediately to turn around and say to the government, this is wrong. The regulatory process has been put forward. Many people in the industry have put forward their information. It's time to turn to the government and say, this is not acceptable, and either they go back to looking at this, or we end it as we speak. So with that said, Mr. Chair, I want to thank you for the ability to speak to this, and I ask my colleagues to support this motion.
Thank you, Dr. Kitchen. Before I recognize Dr. Hanley, I just want to say to the witnesses, you had committed to be here for 1 hour, and we are now approaching the end of that hour. So the first thing I want to say to you is thank you, but the second thing is, if we are able to dispense with this motion, I will be asking the committee to allow you to stay until the end of the meeting in case there are questions for you. So that may be a decision we will take. But I understand that you had committed for an hour. If you wish to leave, you're free to do so. If you are able to stay, there's a chance that you may be able to further contribute if we can deal with this motion and if the committee agrees to include you in the rounds of questions after the next panel gets a chance to present their opening statements. So with that, next on the speakers list on the motion is Dr. Hanley.
Thank you, Mr. Chair, and thank you to our witnesses for their patience. Look, we're all concerned about the viability of the natural health products industry.
Mr. Chair, point of order. The sound in the room needs to be adjusted so that I can hear the interpretation. Thank you, Mr. Theriault. We'll do that ASAP.
There, Dr. Hanley, we want to make sure that it's not dangerous for those listening in terms of the sound levels.
Okay, can I test now? Is this better?
Yes, the sound in the room seems fine. Go ahead.
Okay, once again, thank you, Mr. Chair. And look, I just wanted to emphasize that we're all concerned about the viability of the natural health products industry, just as we're concerned about the safety of Canadians. And first, I want to call out my colleague for calling into question the integrity of Dr. Sharma as Health Canada's Chief Medical Advisor, to call her testimony misinformation, even if there's disagreement over what she said, is frankly outrageous. I want to just clarify
Point of order.
that
Point of order.
Dr. Kitchen?
Sorry, Mr. Chair, but I guess the question is, using the word misinformation, define his interpretation of the word misinformation, if you look it up in the dictionary, is totally different than what the actual terminology is.
That was a point of debate, not a point of order. Go ahead, Dr. Hanley.
Thank you. What Dr. Sharma said was trying to make the point was that if natural health products are making claims against serious diseases and people believe these claims, they may be using those treatments instead of treatments that could potentially help their own condition or that of their loved ones. And that was the context of that was what Dr. Sharma said. Using the word misinformation associated with her is to call into question her integrity. I also know that my Conservative colleagues are equally concerned, if not outraged, at some of the regulatory gaps that we presently experience with natural health products that Health Canada and the Minister of Health are currently trying to address with these changes. So let me quote as follows the testimony from some of my Conservative friends at last year's Public Accounts Committee when they looked at this issue. Conservative MP Jeremy Patzer asking Health Canada officials, why aren't the penalties higher on those manufacturers who fail to meet Health Canada's standards? The maximum fine for violating the law is only $5,000. It seems that it's not a large enough deterrent to stop the bad actors from violating the rules that have been imposed. MP Philip Lawrence asked, do you not find this disturbing? And are there any products out there right now that are supposed to be recalled and are not? And again, when we're seeing things such as literally every single site had issues, but it's only a $5,000 deterrent for having contaminants in your product, what is the level of the sense of urgency to actually get some real strong deterrents and actual teeth that are going to prevent bad actors from taking advantage of Canadians? And I can go on with what are you guys going to do and what is the level of urgency to make sure that we actually get real teeth? Further to that, how do you make sure Canadians are confident in the products they're buying when there are so many holes, gaps, and issues, whether they be contaminated products, expired products, or not even knowing where these products are manufactured or where they're coming from? So look, we called this meeting to hear from witnesses to get evidence on the very questions that are being posed about getting the balance right between product safety and the viability of the natural health products industry. In fact, its ability to thrive with complete consumer confidence. That's why we're calling this meeting, to hear from witnesses with various points of view. It is on that note, I move that debate now be adjourned.
Okay, so we have a motion to adjourn debate. That motion is not debatable. We must proceed directly to a vote. So the question for the committee is that the debate now be adjourned. All those in favor of adjourning debate, please raise your hand.
Chair, I'd like to request a recorded vote, please.
Madam Clerk, could you please conduct a recorded division for whether the motion should now be adjourned? The debate on the motion should now be adjourned.
Mr. Hanley.
I vote yes.
Mr. Jawari.
Support.
Mr. Pawlowski.
For.
Ms. Sidhu.
Yes.
Ms. Bradford.
Yes.
Mr. Ellis.
No.
Mr. Kitchen.
No.
Mr. Doherty.
Nope.
Mr. Majumdar.
Nope.
Mr. Thériault.
Nope.
Mr. Davies.
Yes.
Yeas 6, nays 5.
The debate on the motion is therefore adjourned. We've reached the end of the first hour, so I would now invite our panel for the second hour to come forward. And colleagues, do we have consensus that the witnesses who haven't had a chance to take questions be allowed to remain in the event that some of the time allotted for questions in the second hour could be used to pose questions to all four witnesses? Are we okay to proceed in that fashion? I see heads nodding around the table. So to those who are here, you are more than welcome, in fact, encouraged to stay. We're going to hear opening statements from the next panel, and then there will be an opportunity for members of Parliament to question anyone they wish from either of the panels. So if you could do that, we would greatly appreciate it, and thank you for your patience. So we're going to. While we allow for the next panel to get themselves set up, I would ask them to go ahead and do that now. But colleagues, I don't actually want to suspend the meeting because I think we can use the time productively. There is a housekeeping matter that I want to bring to your attention, and that is simply on the matter of study budgets. So you would have received from the clerk 2 study budgets for upcoming studies that I'm hoping that we can dispense with rather quickly. One is in connection with this very study that we're looking at now, and the amount requested for witness expenses, working meals, and headsets is $8,250. So if we can, it's been circulated, $8,250. As you know, colleagues, this is essentially a pro forma amount that probably will not reflect what will actually be spent, but it is simply to, if you will, allot those funds so that whatever expenses are required, whatever expenses are incurred in the conduct of this study will be available to us. So, so the first is in connection with this particular study, the Department of Health's regulatory changes on natural health products. Any discussion on that proposed budget? Dr. Ellis.
Sorry, Chair, you said $8,250, and do we have an idea? Will it be potentially 10% more or less, 20% more or less?
Yeah, that's the maximum it can be. That allows for an envelope of 4 witnesses to travel from Toronto, 1 from Quebec, one headset for each of the witnesses and one working meal. Then that's the total amount that we're allotting. It will almost certainly be less. Any further questions or debate in connection with that study budget? All those in favor of adoption of the budget as presented, I see unanimity. The second budget is with respect to Wednesday night's meeting to bring in the Ministers of Health and Mental Health and Addiction. The total amount allotted for that is $1,000, which is made up of 2 headsets and 1 working meal. Any questions? Again, we anticipate that the amount expended will be less, but it's necessary for us to block the funds. Yes, Dr. Ellis.
Chair, for that particular meeting, my understanding is the ministers will come, and I don't understand why do they need extra headsets? They already have headsets, and why do they need a meal? Because they would also have a per diem as well.
And they should be here.
I'm advised that the ministers will be accompanied by officials who may be participating remotely.
I guess, Chair, not to be to belabor the point, but realistically, anybody who works for the current government of Canada would have already been allotted a headset, and for us to buy another one, to me, would seem duplicitous. And once again, that those folks, if they're at home, they don't need to have a meal because they're going to eat at home, and if they're here, then they're also then working in their own working environment. So why should we have any budget for this?
The meal is just for
the committee. We're just trying to cover our bases in the event that someone doesn't have a headset. As I said, these funds are being allocated, but will only be spent if necessary, and we doubt that it will be necessary, but that we're erring on the side of caution.
Sure.
Yes, Dr. Ellis.
You know what? I would certainly be happy to approve this if we can revisit this and understand exactly how much was spent with respect to that. If we can revisit that after the meeting, then I think it would make sense to understand. Again, I'll underscore the point. I don't want to be buying headsets twice for folks, or if people choose to work from home, they can eat their own peanut butter sandwich, and if they want to come to work, then they do work in Ottawa. So if we can revisit that budget after the meeting and understand exactly what the implications was thereof. And I realize fully that it's not a lot of money, but it's the actual point of it. So if we could do that, I would happily support it.
Happy to have a conversation after the meeting and include the clerk in it, Dr. Ellis. Any further discussion on the motion to approve the study budget for the appearance of the ministers on Wednesday? Seeing none, are we ready for the question? All those in favor of the adoption of the budget as presented? It's adopted. Thank you very much, colleagues. And I see that our witnesses are now in place. So thank you for being with us. I'd like to welcome our second panel of witnesses representing the Canadian Health Food Association, Aaron Skelton, President and CEO, and Adam Gibson, member, and representing Food, Health and Consumer Products of Canada, Jerry Harrington, Senior Vice President of Consumer Health. Thank you for taking the time to appear today. You'll each have up to 5 minutes for your opening statement, and we're going to begin with the Canadian Health Food Association. So, Mr. Skelton, Mr. Gibson, as you wish. 5 minutes, the floor is yours. Welcome to the committee.
Thank you very much, Chair. Thank you, Adam, CHFA member and former Director General of the NHPD, for joining me today. I want to begin by saying thank you for the opportunity to speak to you today on the regulatory and legislative approach to natural health products by the Government of Canada. I would also like to express my gratitude for the significant achievements of this committee. In 1998, your diligent work on the 53 recommendations led to the creation of a world-class regulatory system. Back then, the vision was clear: to ensure the safety, efficacy, and accessibility of natural health products for all Canadians. The regulations that emerged from your dedication were seen as a model for the world, a shining example of how to strike the balance between consumer protection and industry growth. However, it is with a heavy heart that I must emphasize that this once world-class regulatory system is now facing substantial challenges. The very achievements that were celebrated in 1998 and then in 2004 when the regulations came into force have become mired in inefficiencies, complexities, and a lack of stakeholder engagement. The promises of a robust and responsive regulatory framework have given way to uncertainties, barriers, and mounting concerns for businesses and the 71% of Canadians who rely on natural health products for their well-being.
Sorry, Mr. Skelton.
Je m'excuse auprès du témoin. Je m'excuse auprès.
I apologize from our witness, but they are going way too fast with the interpretation for it to be easily digestible. So it is becoming hard to really pick individual words. They're going too fast. Thank you, Mr. Theriault.
I expect that you may be trying to race through your statement to make sure that you get it all in 5 minutes, but it's causing us some problems with the translation. You can have an extra minute if you can just slow down a bit and make sure that we all get it. Okay? Go ahead.
Health Canada has now simultaneously implemented and proposed multiple regulatory changes for natural health products under the self-care framework, which was initiated in 2014 and intended to bring together low-risk products such as cosmetics, natural health products, and over-the-counter drugs. Many initiatives linked to this overarching, incomplete framework are now being pushed through at the same time, in a piecemeal approach which does not consider how regulatory and policy changes interact with each other. These changes are cost recovery, new labeling regulations, and Vanessa's Law. Health Canada has stated that the regulatory changes are intended to protect Canadians by ensuring the safety and effectiveness of health products. While admirable, the unintended consequences of these changes are becoming alarmingly apparent. Small, local businesses that have been vital in providing Canadians with access to a wide range of natural health products are grappling with the anticipated burden of compliance and increased costs. This, in turn, raises concerns about the affordability and accessibility of these products for the very Canadians that regulations aim to protect. While we agree that regulations are vital for product safety and efficacy, the new proposed over-regulations will have the opposite effect. It will drive consumers towards unregulated international online markets that offer lower-cost products, risking consumer safety. This is not a theoretical risk. Canadians are currently allowed to bring in natural health products via personal importation rules from the U.S. and around the world with zero Health Canada labeling requirements or pre-market approvals. U.S. state governments, like Arizona, are currently pitching tax incentives for Canadian NHP companies to set up in their state and sell back to Canada using personal importation rules. I ask you, how does this better protect Canadian consumers or truthfully benefit Canada in any way? This committee needs to send a strong and formal message to Health Canada that the proposed cost and regulatory burden needs to end here. We need a formal reset. We need to ensure that the NHP framework is well-informed, balanced, and in the best interest of Canadians. Finally, I need to speak out to protect the reputation of our sector. In 2021, an audit by the Canadian Environmental and Sustainable Development Commissioner alleged some startling statistics, including findings that 88% of products had misleading advertising and 56% of those products were mislabeled. It is essential to set the record straight. Subsequent scrutiny of the CESD report revealed that these numbers were not, nor ever intended to be representative of the Canadian market. Specifically, and I will quote, "Purposeful samples were used since it was not possible to do audit statistical sampling given the population was not available," end quote. Efforts to review the methodology used for the audit were also refused by the Auditor General's office, claiming it was, quote, "not appropriate to release statistical methodology," end quote, further limiting the ability to comprehensively examine and validate these allegations. As a result, the reliability of the statistics in the CESD report must be viewed with caution, and a more in-depth and transparent examination is needed to assess the accuracy of these assertions. All of this needs to stop. As an industry, we continue to support regulation and legislation that protects Canadians with transparency and developed in a responsible and appropriate manner. It is imperative that we find a balance between regulatory goals and their real-world impact on the livelihood of these small businesses and the well-being of Canadians. Please, let's hit reset and let's get this right. Thank you very much.
Thank you very much, Mr. Skelton. Next, representing Food, Health and Consumer Products of Canada, Jerry Harrington. Welcome to the committee. You have the floor for the next 5 minutes, sir.
Thank you, Mr. Chairman, and members of the committee for this opportunity to provide our industry's perspective on the Department of Health's regulatory changes for natural health products. FHCP members account for more than half of the NHPs sold in Canada. This includes familiar products like vitamins, minerals, herbal remedies, but also some things that you may not necessarily think of as natural health products, such as nicotine patches for smoking cessation. And along with OTC medicines like pain relievers, cough and cold medicines, and so forth, these self-care products are used by Canadians to prevent or manage health conditions, thereby relieving some strain on our heavily stressed healthcare system. That's why Health Canada has been consulting with stakeholders since 2016 on the development of a self-care framework that would apply a consistent, risk-based approach to these products, regulating both NHPs and OTCs. Now, the self-care framework was proposed as a 3-phase project. First, NHP labels would be updated. The second phase was to reform the regulations governing OTCs, which have not been significantly revamped since the 1960s. The third and final phase would be to update the NHP regulations to better balance pre- and post-market oversight, make these products subject to the authorities under Vanessa's law, and then finally apply cost recovery across this whole regulatory framework. From the beginning, FHCP has been a strong and vocal proponent of this logical approach to the framework. The updated labeling regulations were passed last year, and their very costly implementation is something that we're working very hard with Health Canada to accomplish as the implementation deadlines approach. We support cost recovery. We support the application of Vanessa's law. And we do all of this because we believe that self-care's contribution to alleviating strain on our healthcare system is more important than ever. However, with this NHP cost recovery proposal, Health Canada has abandoned that logical 3-phase sequence and is frankly putting the cart before the horse. Last month, Health Canada told this committee that the current cost recovery proposal was necessary to respond to the audit conducted by the Commissioner for the Environment and Sustainable Development. The CESD report was clear that the current shortcomings of the program, as we've heard previously today, are with respect to post-market enforcement and inspections of facilities. But the CESD clearly endorsed the pre-market product evaluation process. Health Canada's cost recovery response is not consistent with the CESD report or the self-care framework discussions that we've been having for the last 7 or 8 years. Instead, what we have is a cost recovery proposal in the form of a ministerial order, and that is no substitute for a fully consulted Governor and Council regulatory process. Further, the cost recovery proposal itself revealed several core issues of process and analysis. I'll just outline 3 of them for you. First, in their testimony last month, the department said that there are 200,000 NHPs on the market. The proposal itself says there are 50,000. And the survey of industry that Health Canada conducted arrived at 11,000. These are very basic metrics that are vital to accurately identifying the activities and costs associated with the program. Second, the costing analysis shared with us after the proposal was released seeks to more than double the overall size of the program. Specifically, the cost of pre-market product evaluations for the lowest risk products more than tripled under this proposal. This was the very part of the program that the CESD said is not a problem. It is fine. And nor is there any kind of backlog in that category. So we have no idea why or how that money is to be spent. But it's clear that it's not going to be spent addressing the issues raised by the CESD. Third, the department stated that consistent with Treasury Board guidance, the fee ratios used in this proposal, and the fee ratios represent the share of the total cost of the program that the industry must bear, would be exactly the same as for prescription drugs. Now, that it completely ignores the fact that the federal government alone collects over $500 million a year in GST revenues from OTCs and NHPs. Do these revenues not count as a public benefit? And if so, how did we arrive at fee recovery ratios that are exactly the same? So finally, it's worth remembering that unless a proposed fee or service charge meets the requirements of the Service Fees Act, or in this case, the relevant portion of the Food and Drugs Act, that fee is essentially a tax. And I don't need to tell this group that taxes are the unique purview of Parliament. So ultimately, we don't see this proposal as a substitute for the self-care framework. This isn't the time for shortcuts. It really is time to get this job done. Thank you, Mr. Chairman, and I look forward to the questions.
Thank you, Mr. Harrington. We'll now begin with rounds of questions, starting with the Conservatives for 6 minutes. Dr. Ellis.
Well, thank you very much, Chair, and thank you to our witnesses for being here and presenting this very, very important and informative information. You know, we've heard a lot about misinformation and disinformation and et cetera, although I would suggest to folks around this table that what we've just heard presented is incredibly well informed and shows also an industry which is ready, willing, and able to work with government to ensure that it goes forward in a safe and effective manner so that we can have a regulatory framework where everybody wins. And if I might, to Mr. Skelton, through you, Chair, you talked about a system that is world-class with respect to safety and accessibility. And you know, we know very clearly that that other jurisdictions would like to have that. Have you ever been part of those discussions of talking with folks around the world to say, hey, what you have, we would like to have, and could you talk a little bit about that, please?
Chair, we have. I think one of the roles that we play as the representative for this industry in Canada is to liaise with groups around the world. And in those discussions, I will convey that we are undoubtedly seen as a standard for how to balance consumer interest and the interest of businesses in this country. What has been startling for me over the past few years is how disillusioned our international groups have become at the changes or the proposals that are being made. To the point, I think, that has been made multiple times to this committee, this is something where other countries, other regulators had looked to emulate. I think there's, discussions we've had with European regulators. There's discussions we've had with Australia, with New Zealand, where they continue to ask and look for guidance on how did we get here, because they'd like to get here as well. But the concerns over the last few years have been, please don't dismantle, which was something that was working so well because you were seen as a leader globally.
Thank you very much, Mr. Skelton, and again through you, Chair, to Mr. Harrington. We heard very clearly when you talked about these changes by virtue of the nature of how they've been proposed, or as some of us might say, rammed through as they are, amounts to another tax by virtue of the way that the Liberal government has done this and forced its acceptance upon Canadian small and medium-sized businesses. I just wonder, for the benefit of people out there watching, and I know there's many out there from this industry who are very concerned about this, could you kind of review that with us and the unfair nature of it and the perhaps illegality thereof?
Sure. Thank you for the question. Mr. Chairman, when cost recovery was first introduced in Health Canada's health products area in 1994, I was an active participant at that point. We saw a second revision of the cost recovery regime in the decade just past. And in each of those cases, the government of Canada has set down very, very clear rules that distinguishes between cost recovery fees, regulatory charges, service fees, et cetera, and creates very, very clear rules for how they have to be constructed. So, for example, the costing exercise is something that Health Canada was supposed to share in advance of releasing a cost recovery proposal with industry on multiple touch points. That did not happen. We did not see the costing analysis until after the proposal was reached. There's the whole matter that I raised in my testimony around the fee ratios. If it's a public versus private benefit equation, we're having a really difficult time understanding how the fee ratios can be the same for the prescription drug program where there is no taxes and where, in fact, almost 50% of all expenditures are by governments, are out of the public purse. And yet we wind up with exactly the same cost recovery ratios. So this proposal does not meet those requirements in our view. And according to Treasury Board's own guidance on this, that means it is effectively a tax and outside of the scope of the Service Fees Act, or in this case, because cost recovery is now done by a ministerial order, it's not even subject to Treasury Board review before approval. So all of those problems essentially make this, I think, a very tricky matter.
Thank you very much, Chair. And back to you, Mr. Skelton, if I could. We've talked a lot about costs here, and I know that I mentioned during that our motion, which was adjourned by the Liberal side to get rid of these regulations, I did note that our team here tried to calculate the cost per businesses. Can you tell a little bit about the efforts that you've made on behalf of your industry to help those in the industry understand how much this might cost them?
Thank you very much for the question. We've obviously, since we've been made aware, and as Mr. Harrington noted, that was very late in the process, and I think counters to some of the commitments that we had received from the department, but we've been working quite diligently since then. Obviously, it will impact every individual business uniquely, depending on their piece, but I can give a few examples of specific members that we've got. The labeling updates themselves, unlike potentially when it impacted the OTC industry, given these are small businesses, many of them are co-packed, some of them are sharing equipment. The updates to that machinery alone, never mind label stock and things that will take time to work through inventory, can be in the realm of hundreds of thousands of dollars. We have one member who recently underwent it on his own accord, and a small business, again, would fall into that category, but estimated that it would cost him an additional $250,000 to go through and make the labeling updates. I can provide another example regarding cost recovery. Multiple members have gone now through the due diligence of calculating the costs on an annual basis. And they are examples like $450,000 a year, $560,000 a year. And these are annual fees for businesses that, given the competitive nature of the natural health product industry, this is not like the pharmaceutical industry. There are a lot of businesses who have to carry a lot of different products to remain viable. And these are costs that they simply don't have in margin for their businesses today. And I think that was clearly articulated in the study we've commissioned at the beginning of this year, which I'll remind committee are startling statistics. 1 in 5 of these businesses saying that they won't be financially viable. That was only on the back of the labeling updates. That was done prior to the cost recovery.
We're well past time. You'll I'm sure, get ample opportunity to further elaborate on those points. We're going to go to Dr. Pawlowski, please, for 6 minutes.
No, I think certainly I don't think anybody would question the fact that one of the roles of government is to protect the public. And certainly there are concerns about natural health products, and between May 1st, 2021 and April 30th, 2023, the Canadian Vigilance Program received 772 domestic reports of serious adverse effects from natural health products, and that was without Vanessa's law, which requires hospitals to report severe adverse effects. Furthermore, between 2004 and 2023, the Canadian Vigilance Program had received 8,625 reports where the suspected product was a natural health product. Over 5,000 of those 8,000 were identified as serious by the reports. And certainly we know that a number of natural health products have potentially adverse effects. St. John's wort, there's a whole bunch of things with that, including interactions with SSRIs, which are commonly used in treatment of depression, and can cause serotonin syndrome, which can be deadly. There's a number of drugs which are natural health products which cause hepatotoxicity, liver toxicity, for example, pyrrolizidine alkaloids, which includes comfrey and echinacea. Ginkgo biloba has both anticoagulant and antiplatelet effects. So I think there's very significant reasons for the government wanting to protect the health of Canadians. Now, when it comes to the cost recovery program, and I wanted to ask both Mr. Harrington and Mr. Skeleton about this, apparently, and this goes back to between March 2021 and March 2022, there was a pilot project that looked at compliance with good manufacturing practices amongst natural health product manufacturers and found there was issues of compliance in 42% of those companies inspected. Does that not occur to you to be a significant number, which would require better policing of good manufacturing practice among natural health products manufacturers? So maybe quickly on that, are you not impressed by those numbers? I'm certainly impressed by those numbers, and it certainly suggests to me that there ought to be more inspections.
No, I would agree. I think you know the industry has for a long time had a concern with Health Canada's approach, which is very heavy on pre-market activities. The licensing system, which is, quite frankly, in most categories, heavily backlogged right now, but that they have not been enforcing in the field. And so, you know, the authorities are there already. Pre-Vanessa's law, I don't think, you know, personally, we don't have an issue with Vanessa's law, but the authorities are there. The department has continued to emphasize the pre-market activities, and that is the problem. In terms of enforcing and inspections, that has been part of the self-care framework discussions from the outset, and it's something that we strongly support. The thing is we've been talking about that for 7 or 8 years. What we have got instead of that is a cost recovery proposal that doesn't spell out how that's going to happen, that hands the bill to industry, but has not, again, you know, put the program together to ensure that this
now
is
on the
correct.
cost recovery program, and I assume you're all kind of businessmen or associated with businesses, or you're here to promote the interests of businesses. And now I think it was you, Mr. Skeleton, has said that this is a tax that we're putting on natural health products. Now, if we don't do it in terms of cost recovery, which is making the industry pay for it, then is that not making all of the rest of us Canadians pay for it, which means increased taxes, which I would assume you're against? So it would seem to me that let the producer bear the cost rather than people within the public. Mr. Harrington, you're shaking your head, so I have the feeling you're going to give the answer I like, but
either way, the consumer ultimately pays. So I don't think there's a question mark around that. You're right. Whether it's charged to industry or whether it comes in the form of a tax, the issue is get the regulatory reforms in place so that we have a comprehensive approach that deals with a rebalancing of this pre versus post-market and inspections issue.
Less than a minute for the
Mr.
question and the answer,
Mr.
Dr.
Gibson, I'll
Pelosi.
give you a chance to reply.
In a minute, please.
One of the most important things, and I think there's been a long time that this industry has been looking for a stable inspection program. Even when I was Director General, this was something we were trying to institute. I don't think there's a concern there. I think one of the biggest challenges is we're looking to charge for an inspection program that's not recognized by any other jurisdiction or within Government of Canada. So many of these inspections, they'll take place, but then you can be inspected again by the CFIA and then inspected again for the exact same thing again by Health Canada for a drug license at the same establishment. You'll have 5 different licenses, 5 different government employees coming in, checking the exact same documents. This particular inspection program, if we're going to do it, I think it really needs to be recognized so we don't have duplication.
Thank you, Dr. Pelosi. Suite, Monsieur Thériault, pour 6 minutes, s'il vous plaît.
Merci, Monsieur.
Thank you, Mr. Chair. Ms. Vadecchio, Mr. Pawlowski referred to 42% as the number of problematic cases that underwent inspection. What can you tell us more on that? Thank you for the question. Well, we tried to find out where this specific piece of statistics was coming from, and we did not really understand that clearly. Secondly, when I was the CEO of Bioforce Canada, at multiple points in time, and also through the Natural Health Products Association, we asked for criteria and for standards to help with these inspections, remedy the situation, but we never received any specifications or standards about what the inspections were going to be about. We need to not forget that there are many elements of this that are still vague and very open to interpretation. So within our company, in Bioforce, the person who was in charge of regulation asked Health Canada at multiple points in time what they meant specifically by X, Y, or Z, and we never got an answer. So when they say that 42% was not compliant, but compliant with what exactly? If we do not have the rules, what are we going to comply with? If you don't know the rules, then it's very hard to comply. On the prescription side of things, they have very clear criteria, so you know what to expect when there's an inspection. We don't have that. Mr. Skelton talked about the 53 recommendations dating back to 1998. It has been a while, so we have been asking for these criteria for a very long time. Yes, we are asking for inspections to be carried out, because those among us who follow all the rules, and we're already paying a lot of taxes and everything else, we are in favor of inspections. We are in favor of good regulation. That is not what we're saying here. We are asking you to work with us, as we have done in the past, so that we have something that is good for the Canadian consumer on the one hand, but on the other for us as well, so that we can remain in business. Mr. Skelton, Mr. Harrington, if I say the intention to regulate, no one is against that here in this room, would you agree with that statement? Okay. So the industry has not just a financial interest, as mentioned by Mr. Pawlowski, but an interest in general to really improve their reputation, as it were. Because there was this report that underlined problematic situations. We can, of course, look at the pharmaceutical side of things. There are adverse effects on that side of things as well, which are regulated, of course. But I was asking for the numbers. We haven't received the numbers. So just to compare over 17 years the adverse effects of therapeutical agents. So you are for regulation, but you're saying that you want to be able to participate in it, because currently the way it has been done has been that there is an order from the Treasury Board and they just wish to do certain things, but for the rest of it, no impact assessment on cost recovery on the industry, or no impact assessment in terms of the environmental aspect of things. So this is mostly focused on the monetary and administrative side of things, rather than being a more wholesome reform where everyone is really participating, and especially, of course, not to forget the point of view of the consumers. It's not just a question of freedom of choice, it's also about protection of consumers. Would you agree with that?
Thank you very much for the question. We would agree with that. I think our members, the vast majority of which appreciate and understand the benefit of a strong regulatory environment. I think that's why we're so proud of the regulations that we have today, which we've quoted many times, are seen as a gold standard internationally. We can speak to site inspections. I think our compliant companies are encouraged to hear the focus that the CESD put on operational and quality initiatives. I think those are all critical. I would sort of reference back to what Ms. Vaticino said. What is lacking is the enforcement of that. What is lacking is the education around that. What is lacking is the engagement so that, of those site licenses that had some deficiencies, they were clearly understood what they were. We currently don't have a NHP site license guidance document. That will probably shock most people. But as you can imagine, as a small and medium-sized business, if you don't know what rules are going to be used as they're applied to your business, that can be quite concerning and quite hard to be compliant. In our conversations with the department, though, most of those businesses that have some deficiencies are rectified almost immediately. These are simple corrections that just need an education tool to ensure that industry can be, as they want to be, compliant.
Thank you, Mr. Skelton. Ça, c'est tout le temps alloué, M. Thériault.
That was all the time we had for Mr. Thériault.
He's for 6 minutes.
Thank you, Mr. Chair. I'd like to thank all of the witnesses for being here today. I think I speak for all my colleagues when we say that this summer, after the recent proposed changes by Health Canada, we were all inundated with emails from our constituents and businesses in our community indicating great concern about this issue. And I moved the motion to call Health Canada to come before this committee to explain themselves, and I moved the motion to have you here. And I just want to say I think it's very important to have your voice on the record prior to us making decisions in this matter. I've been here 15 years. This is at least the third iteration that I've seen of Health Canada sort of spontaneously and without industry involvement unilaterally try to propose profound changes to a regulatory structure that when I look at the 2003 report, strikes me as being unnecessary. So my first question is this. There was a reference in 1998 when the first NHP regs came, and I have a report in my hand from 2003, 20 years ago, reporting from Health Canada on the 53 recommendations. Mr. Skelton, I want to ask you, you've referred to this already. Do we or do we not have a sophisticated regulatory structure in place in Canada right now for natural health products?
I think we have a very strong and internationally recognized and robust regulatory system for natural health products. Absolutely.
Okay. Now, I've heard the expression that this really is a solution in search of a problem. So I want to probe that a bit. Health Canada has provided what is, to me, inconsistent and confusing information on what the adverse effect record does say about natural health products. Can you tell us what is your data on the injury or adverse negative health impacts caused by NHPs in this country?
Yes, so that information, I appreciate the question. I think that information, what we've determined is very hard to define. We've actually had to engage with a third-party management consultant group for us to try to scrub the data that is currently housed in the database for MedEffects. What they've discovered after we heard the initial quotes made by Health Canada is that information is not readily available. It is not categorized in such a way that information can be pulled out. And the best we could do was sort of put a wider net and then manually go through and try to identify which ones related to natural health products. The best we could find is the potential for 32. And even within those 32, the complications of combinations with pharmaceutical prescription drugs also conflated that issue. So
there were 32 cases of adverse effect from NHPs in what time period?
That would be from 2020 to the current date.
Okay. Now, Mr. Skelton, in a recent interview, you said Canadians looking for their favorite NHPs are likely to turn online and source unmonitored and unregulated products that are less expensive than what they would find on Canadian shelves. Do the proposed regulations by Health Canada effectively address that potential?
I appreciate the question, and the answer is no, it does nothing to address that potential.
Okay. Thank you. Mr. Harrington, you did a good job outlining some of the issues with the proposed cost recovery, and you mentioned the GST. Now, I also understand natural health products are generally not covered by extended healthcare plans like pharmaceuticals are, and they have no patent protection, providing monopolistic pricing period like pharmaceuticals have for 20 years. So is it fair to compare the natural health product industry with the pharmaceutical industry when it comes to cost recovery?
Oh, I think economically they're completely different models. And in terms of the impact of cost recovery on the public purse, there's a fundamental difference between the two, because as you pointed out, they're not covered by health plans. The reason they're not covered by health plans is because they're not considered eligible expenses under the medical expense tax credit. So there are many ways that taxpayer money is going into the prescription drug market, and I'm not disputing the validity of that, but it does completely differentiate the two product categories.
If I understand your testimony correct, are you saying that the proposed cost recovery model for NHPs is the same as for the pharmaceutical industry?
The fee ratio, in other words, the proportion of the total costs borne by government that is billed to industry is exactly the same.
Without taking into account the factors I just raised.
Exactly.
Thank you. Mr. Skelton, we had some talk. It's funny. I've heard Health Canada explain as one of the reasons they want to change the labeling that the current labeling requirements are so difficult that you have to have a magnifying glass, they say, to read it. Yet those are the regulations they have prescribed. So I'm leaving aside that confusion. Besides the fact that there's already a lot of information on NHP product labels, in fact, more than I've seen on others, what is the problem you see with having a reference to electronic information, like scanning, say, a barcode or the QR code, is that what it's called? For any consumer who can get information, is that potentially a solution to the information issue?
Yeah, I appreciate the question. I think the underpinning sort of narrative there is the industry is very open to conveying information in the clearest and most easy to understand format. I think across the industry that's accepted. I think what is challenged is we're not embracing sort of modern labeling solutions. I think you've mentioned a few. I think there's others that we can uncover. But the lack of proper consultation with industry didn't allow any of those to be raised appropriately. Proper patient groups that have interest in this field weren't engaged in a meaningful way. And I think that's where we've landed in a 1980s solution to a 2020 problem.
Thank you, Mr. Skelton. Mr. Davies. Next, Dr. Kitchen, please, for 5 minutes.
Thank you, Mr. Chair, and I'd like to thank all the witnesses for being here and those for staying the extra hour, and appreciate you being here. And I see that Ms. Vedecchio is back online, so I'm glad to see you're still here as well, because I thought we'd lost you. Mr. Skelton, you talked about a number of things that I find interesting, and Mr. Harrington as well. I'll start with the first one on basically when we talk, my colleague, Mr. Theriault, basically asked you about regulation and having a regulator, and sort of nods of head. So I'm assuming, my understanding is the industry is recognizing that they need to regulate, or are prepared to self-regulate themselves. Is that correct?
I would offer, I think it's not only sort of self-regulate, I think it's confidence in the regulatory system that we have today. I think there isn't a need necessarily for self-regulation because there is such a robust and thorough both pre- and post-market regulatory regime that exists in Canada today.
Thank you. And as I've indicated earlier, that I was registrar for the chiropractic profession in Saskatchewan and across country, and ultimately, one of the sayings that I always said, it's the profession's role to protect the profession, or as the association's role to protect the profession, but it's the regulator's role to protect the public. The government is supposed to be in place to put forward parameters such that there will be protection for other outside interests. So ultimately, having that self-regulation is very important, and I think it's important, and everything I'm hearing from the industry is finding ways to work with people to make certain that we can try and regulate that part. One of the things that does happen, and Mr. Harrington, you brought up the issue of inspection of facilities, and as a regulator, you tend to do those sort of things. Ms. Howlett was here in our previous meeting, and I had asked her about how many inspections have been done. And she indicated that in a pilot project that they did 36 in a one-year time frame. And they were aiming to do 37 this year alone. Of that 37, how many businesses are there in facilities in the industry?
Thank you for the question, Mr. Chairman. Pardon me. Hundreds. That is a very small, almost a rounding error of the industry. Now, that being said, it's it's worth emphasizing that the kind of inspection program that makes sense is a risk-based one. You have to target those places where you think there is the most likelihood of a problem that can be rectified. And it's that kind of structure that we're still waiting to hear from Health Canada about, so that we're not, just returning to the coalition of the willing who line up and get these licenses and continue to put these products in the market that are compliant, and then have to compete against non-compliant companies. That's the kind of nuance that is completely missing from the current approach.
Thank you, and I appreciate that, and that sort of leads perfectly into my next question, because ultimately, the government is basically hiring 22 people to do this inspection. But ultimately, as you've indicated, that's not enough, and we need to have steps, and the industry as well needs to put in places to do that. Now, part of what Mr. Skelton talked about was the lack of stakeholder engagement. And that is on this whole issue of not only engagement, but it's also on the issue of inspection as well, is where I see that engagement. Ultimately, Mr. Skelton, most Canadians would turn around and say that take health food products wouldn't have had a clue what went on when C-47 went down. And all of a sudden, if you hadn't gone through that with a fine-tooth comb to go through that issue, and where that what that bill did basically is what I love to use, and a word that I've put through in the House is that I've made up, which is dyspocketnesia, which is what this government does, which is take money from this pocket and put it into that pocket. And this pocket is the public's pocket and putting it into their pocket and then forgetting to do it. And ultimately, when you take words and you create them, here we have an issue of a government that doesn't engage with you. So, Ms. Skelton, for you as an industry, when did you first hear about these steps, and how much has the government come to you to say, hey, we need to talk to you about this?
Okay, Mr. Skelton, we're at time for this round, but please, 30 seconds if you could.
Yeah, I think I would reference back to the congratulation on this committee for the work that was done in 98 and 2004 on the extensive consultation, hundreds of testimonies, patient groups, and the complete lack of engagement on this one. We didn't hear about cost recovery until May 11th, and it was gazetted on May 12th.
Thank you. Next, Ms. Sidhu, please, for 5 minutes.
Thank you, Mr. Chair. Thank you, all the witnesses, for being with us. And my question is to Ms. Highland. You talked about in your testimony some brand names has different ingredients, and to improve safety of the Canadians, how are these regulatory changes going to support a safer marketplace for Canadians that consume natural health products?
I think I'll answer that with Health Canada's approach is seen as reasonable and supportive, and we have seen some examples of labels. I think, Jerry, you mentioned it, where there is embracing the new regulations for labels. So we have seen some examples where label changes have been made. I think that with the, I'm also hearing that we need more enforcement. We have a lack of enforcement, and the cost recoveries are intended to have that happen, better compliance and better inspections. So does that answer your question in terms of maybe the other part of the answer is if we have products facts tables consistently on all products, similar to nutrition facts tables on our food products, I think it's going to be easier for both consumers and professionals to look at the products, compare products, and make selections without errors.
Thank you, Ms. Highland. Do you want to add on that, Ms. Sheldrick, why it's so important, these regulatory changes for Canadians?
Sure, thank you. The product facts tables that have been improved are very readable for the consumer. They can go into the store and they can select the product they're looking for, and they can read it, and it's clear that they know what they're buying. Sometimes what might happen is if you buy a product where the information is not clear, you spend an amount of money and you take it home and it's the wrong product and then you can't return it, which is an additional cost to consumers because then they go back and they replace it with another product. So there is considerations for cost on consumers, but we have to look at it very carefully, and really the priority is the clarity of those labels and getting that information to consumers as clearly as possible, because that will impact the safety and the quality.
Thank you, Ms. Sheldrick. Mr. Chair, I want to share my time with Brendan. Dr. Hanley.
Dr. Hanley, please.
Thank you, and I want to again thank all of the witnesses. All of this information has been really useful to inform further steps, and I only wish my Conservative colleagues had allowed us to get the most out of your testimony rather than theirs. But I certainly hear the concerns that industry representatives have brought forward, and these are really valid concerns. And I just wanted to point out on cost recovery, my understanding is that consultations are still ongoing, and this is a draft proposal. So I'm glad we can get some of those concerns on record, including that Health Canada is still in the process of consulting with industry. My questions, I know I don't have a lot of time, but we'll be back to Ms. Hyland. And, there have been many questions about the lack of ability to get the data that we need to have a good sense of the incidence of adverse effects. Now, under Vanessa's law, my understanding is that this will add a mechanism to get better data on adverse effects. I wonder if you could comment on that aspect.
Yes, thank you, Mr. Chair. Thank you for the question. So, firstly, most Canadians don't yet know where and what to report when they have concerns or incidents of harm. So truly, we don't have all the data and the knowledge of the harm that natural health products might be causing. And to your point, and it's great to hear industry support for Vanessa's law, because with Vanessa's law, we will see more reporting and learning, and this will inform continuous improvement, including the warning statements on packages for the consumer. Does that answer your question, Mr. Chair?
Yes, yeah, thank you.
30 seconds
I think that's
for the question and the answer, Dr. Hanley.
Yes, I'm aware of that. I just want to talk about, again, there's been a lot of talk about getting the balance right. Does an improved sense of consumer confidence and safety, is that something that will be a potential plus for the businesses that we're all concerned about?
So it's up to me.
Very briefly,
That's
please.
to you, Ms. Hyland.
Wish to respond?
I think the main point is that, and I heard that the regulatory requirements in Canada are perceived as very strong, and yes, I think there's so much that's been done to regulate NHPs. Canadians think and believe that all of these requirements are actually being met when they buy that product. So all of this work that has been put into place by Health Canada to enforce the new authorities that are created, that's all being done because Canadians already expect they're there. When they pick a product in a store, they are expecting that it is safe and effective. And we heard that in pre-market, the work is very well done, and we need more monitoring and compliance checking with the new requirements, as well as reporting and learning, so that we have more data and more knowledge. Does that answer that question?
It does indeed. Thank you, Ms. Hyland. Mr. Thériault, 2 minutes et demie. Voulez-vous faire un échange avec Monsieur Davies?
Do you want to swap places with Mr. Davies? No, it's okay, Mr. Chair. I did not think that we had more time. I will ask a labeling question. So the more elements there are on a label, the less likely a consumer is to read it. We have a specific problem about this in Quebec. Of course, French will have to be on the label, and it becomes hard to put everything on the same label. So there might be an increase in paper use or packaging. Will get bulkier. So on a personal note, I'm not able to read everything. If I cannot read everything on a label, I do not buy a product. So what do you propose? What would be the solution on the labeling front? Because on the one hand, we are being proposed a solution that will come into force in 6 years' time. So people will have time to change stuff, they will spend money, and this, I mean, as we're speaking about it, it's already outdated. So can we sit down all together, find a solution? Please propose to us some solutions on that front.
One of the things, and I agree with our colleagues from ISMP, this is very important, is actually analyzing this information that we have coming in. It's called a human factor analysis. There's good guidance at Health Canada regarding that. And I can say categorically, I have it in writing from Health Canada, they refused to conduct one regarding this most recent labeling initiative. It's one of the big irritants that industry has, is that we aren't confident that we're necessarily solving the problem. But the problem, I think what you're describing, we've seen from professionals from the University of Toronto have identified the fact that you can't solve all problems with labels. You have to look at other ways of communicating. And the other issue we have is the length of warnings. We saw the green tea liver warning label double in size, essentially twice as many words. And that's hard for people to understand. It's hard for them to get to. What we really need to do is sit down and talk to experts, do the proper analysis, and come up with solutions that aren't all our eggs in one labeling basket, to actually find the correct solutions. Because there's a lot of good information that's coming from groups like ISMP. We just need Health Canada to conduct the analysis in a way that we all respect and can see it published. That never took place in the last 4 years of consultation. So that's, for us, is one of the big things that's important, is the correct analysis and really finding the right tool to solve the problem.
Thank you. The last questions will come from Mr. Davies, please. 2.5 minutes.
Thank you, Mr. Chair. Well, just before I leave labeling, I'm confused by numbers as well, because Dr. Sharma left the impression with this committee that the vast majority of product samples that were reviewed by the Auditor General were advertised with misleading product information, but Health Canada's own compliance monitoring project from 2015, which tested natural health products for vulnerable populations, found the opposite. They found that they did a label review and found 92% to be compliant. What do you have to tell the committee in terms of the accuracy of labeling on NHPs in this country?
We would trust the compliance enforcement report that you referred to, the 90%. We have investigated the numbers used by the Auditor General. They're not representative of the population. We essentially say every single big box store, every single pharmacy in the country, everyone, even Amazon, 90% of that's non-compliant. That's just false, and we learned that those numbers were patently false. And so we see them repetitively used. The compliance numbers you refer to, those are accurate.
I understand there's a controversy about whether the Auditor General was purposefully sampling or randomly sampling.
We have that in writing now.
I just want to leave the last words to you. If these regulations go ahead, tell us what the impact on Canadian businesses in the NHP industry and consumers will be in this country.
Thank you very much for the question. We know firsthand through our engagement that a significant portion of businesses would be financially unviable. Those businesses employ Canadians and service other Canadians. Products on shelf would be drastically reduced, and the prices of the products that remain would go up. So at a time when Canadians are looking for the most efficient way to spend every dollar they've got, this would make utilizing natural health products to support their health that much more challenging, all while leaving online international markets open for lower cost products that don't have the same sort of rigor and regulation oversight that we're so proud of here in Canada.
Thank you very much, Mr. Davies, and thank you to all of our witnesses for your patience, for your expertise, and for cramming an awful lot of information into the time allotted. Be assured that we greatly appreciate you being here with us today and sharing your expertise in the way that you have. Colleagues, is it the will of the committee to adjourn the meeting? We're adjourned.